Hi, everybody. So this is going to be a quick video on two topics that are near and dear to me, and both have been in the recent medical literature and have even penetrated into the lay public's literature. One of them is about statins, cholesterol medication. If you're my patient, and by the way, I'm not giving anybody today medical advice, whether you're my patient or not. I'm giving you information that has recently come hot off the presses, as they say, but is very much aligned with my philosophy and what we promote here in the office. One of them is about cholesterol. Cholesterol medications, statins, as we all know them. The most prescribed drug on planet Earth are statin medications that lower cholesterol and lower LDL cholesterol, which has a supposed endpoint of decreasing heart attacks and strokes and all-cause mortality, etc. Now, all of the data was based on what's called relative risk versus absolute risk. Relative risk is like putting lots of patients into a bag and just pulling out an average. So what will happen to that person in an average? But absolute risk takes each individual patient to their particular risk factors, their particular history, etc., and tries to predict if treating the cholesterol with statin therapy will help those endpoints. I'm happy to say this new article came out recently looking at a meta-analysis, looking at data at absolute risk versus relative risk. And the all-cause mortality went from approximately 7 to 10% reduction with statins to 0.8%, less than 1%. Heart attack, 7 to 10% reduction with statins, relative risk, 1.3 absolute risk. And stroke, they had it to be about 7 to 10% reduction, relative reduction risk, 0.4%, 0.4. What that means is that lots and lots of people need to take statins for many years to get even a small incremental improvement in these outcomes. Doesn't say not to take statins. I'm not saying that. I'm just saying that the data that has been used by all of our healthcare providers, physicians, the pharmaceutical companies, the scientists that have been studying this have been using a relative risk model, which has now been found out in a very prestigious journal to be not really the important data. The data is absolute risk, in my opinion. So take it for what it's worth. The second thing that is near and dear to me is an article that recently came out looking at the C-reactive protein, which, as you all know, is the most important inflammatory marker, which is a predictor of the potential for diseases. All chronic diseases like cancer and heart disease and brain diseases start with chronic cellular inflammation. The C-reactive protein, CRP level, as you know, because we go over it in the office, is a measure of that. And the second most important blood test on the whole piece of paper. A recent study came out, also in a prestigious journal, looking at elevated C-reactive proteins in people that are vitamin D deficient. We talk about vitamin D in the office all the time. If I could only take one supplement every day out of the many that I take, it would be vitamin D. Vitamin D is a hormone. Vitamin D has a protection of your immune system, cancer risk, neurologic risk, anxiety, depression. You can go to the websites and you can look at what vitamin D deficiency is promoting versus what good levels of vitamin D are. And here we have a direct linkage between deficient vitamin D levels and elevated C-reactive protein. If your C-reactive protein is elevated, you want to get it down. And if all it takes is improving your vitamin D level, then that's as simple as taking a pill. So, in this article, the conclusions were that an inverse correlation between vitamin D levels and the C-reactive protein in a large patient cohort. And it shows that it's strongly related, especially in inflammatory disease states. So, these are ways of promoting good health, whether it's statin therapy, which I'm not telling you not to take. I'm saying look at the data, whether the side effects and the potential damage done to the brain, the liver, the muscles is worth that small percentage improvement if you're doing everything else correctly, which is taking care of yourself and exercising and not having blood sugar problems, etc. And the other thing is, when you're in my office, you're going to definitely hear what your C-reactive protein is. There's a lot of ways to bring it down through exercise, weight loss, etc. But vitamin D correlated deficiency states with an elevated C-reactive protein, which is the same as saying that if your vitamin D level is low, you're going to have more risk of having chronic diseases as you age. Pretty profound, pretty straightforward. I hope this kind of information that comes directly from recent data, you can go to Google and look up both of them. They're going to be on a recent journal article. Listen and keep trying day to day to improve the small things, and that's what's going to keep people healthy and well. Have a good day.